8 silent signs. Your pancreas is failing. In the world of health, few organs are as essential and at the same time as mysterious as the pancreas. Today, we're going to dive into the secrets of this vital organ, exploring its dual role in our well-being, in the digestive and endocrine systems, and uncover how it influences everything, from our digestion to blood sugar balance. But did you know that a simple change in diet can protect your pancreas from serious diseases? Or that certain seemingly common symptoms can be warning signs of pancreatic problems? And, more intriguingly, how early diagnosis can be key to avoiding serious complications? Stay with us to unravel these questions and find out how to keep your pancreas healthy and functioning perfectly. Let's get started. The role of the pancreas. The pancreas plays an essential role in our well-being, acting in two vital body systems, the digestive and the endocrine. It produces enzymes that are fundamental for breaking down proteins, fats, and carbohydrates, thus facilitating digestion. Additionally, it neutralizes stomach acids, preventing inflammation in the duodenum. A failure in the production of these enzymes can lead to intestinal inflammatory problems. In the realm of the endocrine system, the pancreas regulates blood sugar through the production of insulin and glucagon, balancing glucose metabolism. This is crucial for the supply and storage of energy our body needs. Therefore, maintaining the health of the pancreas is vital to ensure proper body functioning and to avoid diseases. Pancreatic disease. Discussing pancreatic problems can be complex, especially due to the difficulty in diagnosing them correctly. Pancreatitis, which presents in both acute and chronic forms, is the most frequent and cunning problem of this organ. Initially, its symptoms, including bile vomiting and pain in the upper left part of the abdomen, can be easily mistaken for intestinal poisoning, which often delays the recognition of the situation's severity. Such confusion can prevent people from seeking immediate medical assistance, crucial during a pancreatitis episode, as the functional tissue of the pancreas can deteriorate rapidly. Interestingly, symptoms can spontaneously recede after the acute phase, leading to the misconception that it was just common food poisoning, without the awareness of the underlying seriousness. Over time, chronic pancreatitis sets in, progressively degrading functional pancreatic tissue and replacing it with connective tissue. This evolution not only impairs digestion, but also affects the thyroid gland and can lead to the development of diabetes, underscoring the importance of early detection and proper treatment of these pancreatic conditions. Symptoms of the disease. 1. Feces with food particles. When the pancreas is sick or functions inadequately, such as in cases of pancreatitis or in patients with pancreatic insufficiency, its ability to produce digestive enzymes is severely compromised. These enzymes, like lipase, amylase, and protease, are crucial for breaking down fats, carbohydrates, and proteins in food. Without a sufficient amount of these enzymes, the digestion process is incomplete, resulting in partially digested foods passing through the gastrointestinal tract. This can lead to the presence of visible food particles in the feces, as well as other symptoms like diarrhea and poor nutritional absorption, reflecting the body's inability to properly process and absorb nutrients. 2. Episodes of poisoning. Episodes of poisoning, or metabolic intoxication, occur in pancreatic problems due to dysfunction in the production of digestive enzymes and glucose-regulating hormones like insulin. This can lead to the accumulation of toxic substances and dysregulation of blood glucose, causing poisoning symptoms. The pancreas plays a crucial role in digestion and metabolic regulation, with its dysfunction being potentially dangerous. 3. Pain on the left side and back. Pain on the left side due to pancreas problems occurs because the pancreas is located in the back of the abdomen, behind the stomach, in the upper left region of the abdomen. When the pancreas becomes inflamed, a condition known as pancreatitis, or when there are other pancreatic complications, such as tumors or cysts, the pain can radiate to this specific region. This pain is often described as sharp and may intensify after meals or become constant. The position and nature of the pancreas contribute to the pain being felt specifically on the left side, and depending on the severity of the condition, the pain may radiate to the back. Pancreatic pain can be a warning sign that something is wrong, requiring medical evaluation to determine the exact cause and appropriate treatment. 4. Weight fluctuation. Problems in the pancreas affect the production of digestive enzymes and hormones like insulin, essential for digestion and nutrient absorption, as well as glucose regulation. This can result in poor nutrient absorption and changes in glucose metabolism, leading to weight fluctuations. Weight loss can occur due to poor absorption, while weight gain may arise from metabolic dysregulations. 5. Stomach discomfort. When the pancreas faces problems, such as pancreatitis or tumors, its ability to produce digestive enzymes is affected. This compromises the proper digestion of food, leading to the buildup of gases, abdominal distension, and stomach discomfort. Moreover, changes in the regulation of hormones, like insulin, can impact overall metabolism, exacerbating stomach discomfort. 6. Nausea and vomiting. Nausea and vomiting are common symptoms in cases of pancreatitis, both acute and chronic. These reactions can be intensified after consuming food, especially those high in fats. These symptoms occur due to inflammation of the pancreas, which interferes with the organ's normal function of aiding in digestion and regulating blood sugar levels, leading to a general feeling of malaise and abdominal discomfort. 7. Abdominal bloating. When there are problems in the pancreas, such as pancreatitis or pancreatic insufficiency, the production of essential digestive enzymes for breaking down food is compromised. This leads to inadequate digestion, resulting in fermentation and gas formation by the undigested material in the intestine. Additionally, inflammation of the pancreas can cause fluid accumulation in the abdominal cavity, contributing to swelling. These combined factors cause abdominal bloating, discomfort, and can lead to more serious complications if untreated. 8. Oily or pale stools. Oily or pale stools, also known as staturia, are an indicator that the pancreas may not be functioning properly. This symptom arises when there is a deficiency in the production of pancreatic enzymes, essential for the breakdown and absorption of dietary fats. Without these enzymes, fats pass through the digestive system without being adequately digested, resulting in stools that appear lighter, float, and have an oily or greasy texture. This sign of fat malabsorption is common in conditions affecting the pancreas's ability to secrete enzymes, such as in chronic pancreatitis or in cases of pancreatic cancer. Causes of the disease. Pancreatic dysfunctions, often associated with lifestyle choices and diet, such as high consumption of fast food, foods high in fats, and alcohol, have their roots also in stress and genetics. Observing symptoms like excessive thirst, constant hunger, dizziness, sleepiness, and the smell of acetone in urine is crucial, as they indicate the possibility of diabetes. These signs suggest the need for a medical evaluation of the pancreas and other gastrointestinal organs, underlining the importance of monitoring health to prevent pancreatic problems and their complications. Foods for pancreatic health. Damaging the pancreas has serious consequences, sometimes requiring continuous or even lifelong treatment. It is crucial to adopt a diet rich in foods that strengthen its health and functioning to protect this essential organ. 1. Red grapes. Red grapes are rich in resveratrol, an antioxidant that defends cells against damage caused by free radicals. Besides strengthening blood vessels and reducing inflammation, resveratrol is effective against cell death in cases of pancreatic cancer, offering significant protection to this organ. 2. Omega-3. Rich fish. Fish rich in omega-3, such as salmon, mackerel, and sardines, are extremely beneficial for the health of the pancreas. These omega-3 fatty acids have powerful anti-inflammatory properties that can help reduce the risk of pancreatic diseases, including pancreatic cancer. Regular consumption of these fish contributes to improved cardiovascular health, supports brain function, and regulates blood sugar levels. Moreover, including these fish in the diet can assist in maintaining a healthy weight, a crucial factor for the health of the pancreas. 3. Jerusalem artichoke. Jerusalem artichoke is beneficial for normalizing metabolism and reducing inflammation of the pancreas. Its juice can prevent diabetes and atherosclerosis, diseases often linked to pancreatitis, making it a healthy addition to the diet. 4. Turmeric. Turmeric, known for its strong anti-inflammatory properties, helps stimulate the proper production of insulin, preventing diabetes. Moreover, it contributes to preventing the formation of gallstones, reducing the risk of pancreatitis, making it a valuable dietary supplement for pancreatic health. 5. Pumpkin. Pumpkin, extremely nutritious, is excellent for the pancreas and liver, thanks to its vitamins, minerals, and carotenoids, which are powerful antioxidants capable of reducing inflammation and preventing cell death. It facilitates the digestion of fats and contributes to weight loss, as well as improving digestion due to its rich fiber content. Consuming pumpkin in various forms, such as purees, roasted or steamed, along with other vegetables, can be a delicious way to detoxify the body and ensure the proper functioning of the pancreas. 6. Blueberries. Blueberries are extremely beneficial for those with diabetes, helping to lower blood glucose and improve pancreatic function, both through the tea made from their leaves and the consumption of the fresh fruit. Besides being a vital component of various herbal blends to reduce pancreatic inflammation, cleanse the liver, and enhance bile production, in cases of acute pancreatitis, it is recommended to consume cooked and mashed blueberries to ease digestion and maximize their therapeutic benefits. 7. Yogurt. Consuming low-fat yogurt without additives, such as colorants or flavorings, is beneficial for the health of the pancreas due to the probiotics that strengthen the immune and digestive systems. Moreover, regular and detailed medical examinations are essential to identify and treat health problems early, such as pancreatitis, avoiding serious complications that can reduce life expectancy and quality. In some cases, the treatment for pancreatitis can range from medication to surgery, depending on the severity. 8. Garlic and onion. Garlic and onions are fundamental in the diet to promote pancreatic health due to their potent anti-inflammatory and antioxidant properties. These vegetables are rich in sulfur compounds, like allicin in garlic and quercetin in onions, which have been shown to reduce the risk of developing pancreatic cancer and other pancreatic diseases. Regular consumption of these ingredients can improve immune function, combat inflammation, and even help regulate blood sugar levels, which is crucial for the prevention of diabetes, a condition that directly affects the pancreas. Incorporating them into daily meals, whether in cooked dishes, soups, stews, or even raw in salads, can provide significant benefits to pancreatic and overall health. 9. Tomatoes. Tomatoes are excellent for pancreatic health thanks to their high lycopene content, an antioxidant that has been linked to a reduced risk of pancreatic cancer. Besides lycopene, tomatoes are a rich source of vitamins C and K, potassium, and fiber, contributing to cardiovascular and digestive health. Regularly consuming tomatoes, whether in salads, soups, or sauces, can offer antioxidant protection and promote healthy pancreatic function. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.